Very pleasant meeting to all. Myself is Dr. Sivakumar, consultant pulmonologist, Dr.KAMAKSHI Memorial Hospital, Chennai. Now we are going to discuss something about the post-COVID sequelae. How do we diagnose this sequelae? Diagnosis is based on the symptoms and based on the symptomatology and also the clinical profile which the patient comes to us. It can range from chest X-ray, if needed, CT chest. Pulmonary function testing is one of a very important tool by which we can able to differentiate whether the patient had a obstructive airway disease or it can be the restrictive airway component. Diffusion capacity of the lung can be estimated by you by seeing the DLCO. It will be very useful in case of fibrosis, and ABG, arterial blood gas, can be very useful if the patient had a respiratory failure during the hospital stay. So these are all the varying diagnostic things, and of course if the patient had a CNS involvement or a CVS involvement or a renal involvement, we have to diagnose it, yes, appropriately by the concerned specialist. The treatment options, what are the treatment options that are available in order to treat this post-COVID sequelae? As I already told you, if the sequelae is of bronchitis, bronchiolitis, or it can be the bronchiolitis obliterans organizing pneumonia, then the treatment is going to be the bronchodilators, steroids, inhalers, rotacaps, and very importantly, we have to do the incentive spirometry. It is like a breathing exercise by which we have to keep ourselves in a better way, and those things has to be taken care if it is a very mild to moderate infection. And if it is going to be the severe sequelae, as we had discussed, it can be the sequelae that is there within the patients who are in hospital. Then the treatment modality can range from oxygen mask, high flow nasal oxygen, non-invasive ventilation, intubation, ECMO. We all might have heard about this extracorporeal membrane oxygenation. In our hospital, in our center, we have all these treatment modalities, and we have been treating so many patients. And during the pandemic, at the peak of the pandemic, we had so many patients who got recovered and who had a very good results out of this. So these are all the varying treatment modalities that can happen. So what I want to say to the general public and also to those patients who got recovered from the COVID is, there is a thing called post-COVID sequelae, which in a simple layman term, it is the late effect of the COVID. Since this COVID virus being a very new virus, we don't know about the exact thing that can happen in a long term. So we would like you to have a regular follow-up. So we physicians as well as pulmonologists and all the specialists are there with you, and we have been very keen to serve you for your needs. And these are all the symptoms that can range. So don't forget these symptoms which I want to tell you again. It can be the excessive fatigability or the tiredness, the shortness of breath or the dry cough or the wheezing or the chest tightness you can have. So don't neglect these symptoms, because if we can able to diagnose the sequelae at the right time, then we can give you a better relief so that you can have a very healthy lungs. So always there is a say, we have to have a good breath to have a good life. So have a healthy lung, have a healthy life. Thank you.